Quantitative article number 1. Research shows comparison of negative pressure wound therapy using vacuum-assisted closure with advanced moist wound therapy in the treatment of diabetic foot ulcers. The purpose of this research study is to evaluate the clinical efficacy of negative pressure wound therapy using vacuum-assisted closure compared with advanced moist wound therapy to treat diabetic foot ulcers. The target population consisted of 278 patients with 139 patients, each in Group A and Group B, who were subjected to the advanced moist wound therapy and vacuum-assisted closure with negative pressure wound therapy. The measurement tool were wounds assessed weekly for 2 weeks. The wounds were photographed digitally following initial debridement, if required, and at weekly interval with reference markers including patient ID, date, and scale in 3 dimensions. Wound dimensions and surface areas were determined in a blind fashion using UTH-CSA image tool. All the data was collected through Performa and was entered into an SPSS version and analyzed through its statistical package. The chi-square test was used to compare the efficacy following the use of the advanced moist wound therapy and the negative pressure wound therapy. The sample t-test was applied to compare the quantitative variables. Benefits of the negative pressure wound therapy is to decrease the risk of the infection, preserve limb function due to diabetic ulcers having a high rate of amputations, and preserving life of the patient. Concerns that arose with negative wound pressure therapy is comorbidities, degree of infection, and grade of ulcer. Managing these foot ulcers is largely determined by the grade of the ulcer, vascularity, and presence of the infection. Thus, research study was feasible through the study being approved by the Hospital Ethical Committee. The findings revealed that a greater proportion of foot ulcers achieved complete ulcer closure with negative pressure wound therapy at 43.2%, rather than advanced moist wound therapy having complete closure at 28.9%. Overall, the relevance of this study shows that using negative pressure wound therapy is more efficient in treating wounds and preventing wound complications.